Hello, everyone, and welcome back to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelley, and today we're diving into an incredible, important topic, the connection between obesity and cancer. This is a powerful conversation because it impacts millions of people, and it's about much more than just statistics. It's about people's lives, their dignity, and their futures. Now, we know that obesity increases the risk for at least 13 types of cancer, including breast, colon, endometrial, kidney, liver, and pancreatic cancer. And these cancers make up 40% of all cancers diagnosed in the US each year. But why does this happen? And what we see here is that the excess body weight that we see in individuals living with obesity can lead to chronic inflammation throughout the whole body. It can increase hormones like estrogen or insulin that create an environment where cancer cells are more likely to grow and multiply. Also, the extra estrogen can increase the risk of breast, endometrial, and ovarian cancers, whereas insulin and other hormones have been linked to colon, kidney, prostate, and endometrial cancer. It's important to note that not everyone with obesity will develop cancer. Many other factors like genetics and environment play a role, but understanding this connection gives us a chance to take action, especially through preventative care. Now, preventative screening tests like mammograms, colonoscopies, pap smears are critical tools for catching cancer early when it's the most treatable. And in some cases, for people who are at higher risk, screenings may need to start earlier or happen more frequently. So it is important, it's an imperative to please talk to your doctor on what's the best for you, and also disclose your family history. And if you don't know what you're passed away with, ask, because so many people don't necessarily talk about their family history, especially when it comes to cancer. They just know she passed away, but they didn't know why. And it can help you to know where you are. Are you at higher risk for cancer because of cancer that runs in the family? So make sure you talk to your family members and find out for you, and let your doctor know so that they can make sure to get the proper testing for you. Now, when we think about these preventive tests, there are many people living with obesity that don't always get these vital tests. And that brings us back to a crucial part of today's discussion. And we've talked about this before, but talking about weight stigma and bias in healthcare. Weight stigma is a huge issue in healthcare, and it can show up in different ways, from doctors blaming all health problems on a person's weight, to maybe insensitive comments made by the nurse or some of the staff, or simply the physician not offering appropriate treatment options because they think it's all due to your weight. And imagine how it feels to finally work up the courage to go to your doctor for a preventive exam, only to be met with judgment or embarrassment. And unfortunately, research shows that people with obesity often delay or avoid medical care because of these painful experiences. And it's not just feelings. It directly affects health outcomes. I've had patients who told me that they avoided getting pap smears because they were always taking too long because the doctor could never find the cervix, or the speculum wasn't correct, or they didn't have the right gown. Like, it just made people feel so embarrassed by it. And when people avoid care, because they're expecting this weight bias, this mistreatment, they miss out on early detection and some support and intervention. And like I said before, it's not just about attitude, because sometimes the physical setup of clinics create barriers too. Imagine, maybe you have machines or a table that aren't built for larger bodies. I was talking to a lady, and she had to postpone her cardiac treatment procedure because the table was not large enough, would not fit her body. I've had other patients where we couldn't get them an MRI because it was not built for their larger body. And sometimes it's even small things like the gowns don't fit. They're tearing in the back because now they're paper for the most part, and they're tearing in the back because they don't fit. Or exam tables aren't sturdy enough. You get on the table and it goes up and down. I mean, all these factors send a message, whether intentional or not, that you don't belong here. And the emotional toll is heavy. And that fear of being shamed, reliving past traumas, or just feeling invisible. And so it's no wonder why so many individuals living with obesity may delay or avoid essential screenings. And I hope if you are putting off preventive exams, I hope you will reconsider after this episode and make an appointment for your preventative exam with your doctor or your physical, because we have to advocate for ourselves. It is important for people living with obesity to know their rights. You deserve respectful, high quality medical care. Oh, and don't hesitate to ask for larger size gowns or the appropriate equipment, even if you have to make a different appointment. If you don't have the proper speculum, can you all get it? And I can come back another time. Also, it's important to find providers who are compassionate and weight inclusive. And if you have to go and see multiple people, you do that because you deserve it. You deserve it. And I want you to tell yourself that you deserve proper care. Also, sometimes bringing a support person just to hear what they're saying to the appointments, just so that you have somebody that is hearing what the doctor's saying. It's not just you. Also, ask the doctor what other diagnosis could be causing your symptoms besides your weight, especially if they're like, oh, your knee pain is your weight. Well, could there be something else? Because I did have a trauma a few weeks ago and now my knee, which was not hurting, is now hurting. So what else could it be? Or go to a different doctor until you get somebody who will listen. And for the healthcare providers who are listening, we need to do better too. We must create a welcoming environment, invest in proper equipment, and commit to training that addresses weight biases head on. Compassionate care isn't optional. It's required. Now, how can one reduce that cancer risk due to obesity? Well, the Iowa Women's Health Study showed that women who lost 20 pounds or more had a 14% reduction in the risk of obesity-related cancer. And if the weight loss was sustained for some time, it was associated with lower breast cancer risk. And they've done research looking at breast cancer survivors, and they found that intentional weight loss, like diet, exercise, or even bariatric surgery of greater than 10% actually reversed the pro-inflammatory state of obesity. So they had less inflammation, which leads to less cell proliferation. And if we know what cancer is basically when you have abnormal cells that keeps growing or doubling, and now they're creating this cancer. And so by reducing your weight, you reduce that inflammation, that pro-inflammation state, less cell growth or that kind of overgrowth of cells, of abnormal cells. However, in this same study, if there was a weight gain of 10% or more, especially in those with post-breast cancer diagnosis, it actually elevated the risk of overall mortality. So it is important to definitely reduce your weight if you're at risk. If you are one who has already survived breast cancer, maintaining your weight is going to be extremely important. But definitely if you're actively being treated for breast cancer, don't focus on your weight. We just need you to get through that treatment and make sure you discuss with your oncology doc when it's time for you to kind of focus on your weight. Now, there is something hopeful I want to just highlight, especially there are certain medications that we use for obesity that can also reduce that cancer risk by reducing that cell proliferation or cell overgrowth and improving metabolic health. For example, metformin, it definitely gets a bad rap. I have patients that come in and tell me all these horrible things about it. But this medication that we use for diabetes has been shown to lower your insulin levels. And if you remember in the beginning, insulin can increase that cell overgrowth. And so by lowering those insulin levels, it can help with slowing down the growth of some cancer cells. Orlistat is a medication that blocks fat absorption. That has been shown in early research to possibly interfere with pathways that fuel cancer cell growth. And then also your GLP-1 receptor agonists like semaglutide not only helps with weight loss, but also can lower inflammation and improve insulin sensitivity. So lowering the insulin levels that can contribute to a more healthier internal environment that is less supportive of cancer development. Now, once again, the cancer, there are many factors that can cause cancer, like genetics and other factors. So it's not just this, and these medications are not a cure or a guarantee, but they're just important tools that can, help with losing weight, but also help improve your overall health and possibly reduce that cancer risk. And it's just another reminder that treating obesity is much more than just weight. It's about improving your total health and longevity. So in summary, we explored how obesity increases the risk of certain cancers, how stigma can drive people away from preventive care, and how medications and weight management strategies may help lower that risk. And so if you're living with obesity, I just want to let you know you're not alone. If you're interested in learning what else can you do to lose weight, please look at our prior podcasts where we talk about different diets and different tips and tricks that you can use to lose weight. And then last but not least, I want you to remember this, is that you are worthy of care, respect, and support on every step of your health journey, okay? On every step of your health journey. And remember, early detection can save lives. Don't let fear, shame, or bias keep you from getting the care you deserve. I thank you so much for joining me today. If this episode encouraged you, please share it with a friend who needs to hear it. Don't forget to leave a review so we can keep reaching more people on their journey. And if you have questions or want to hear about specific topics, reach out to me either at Dr. Shelley MD or visit my website at drshelleymd.com. So until next time, stay strong, stay committed, and stay consistent. And I'll see you next time.